Now, let's see a brief video of how to use Achilles DX, a platform for preliminary AST powered by artificial intelligence. Well, once you have the bacteria identified, you click here in Identify Now, and you can choose from any of this group of bacteria. Let's say, for instance, that we will choose Enterobacterales. Once you click here, you can change the system, and if you're using MALDI by the top, MALDI Biotyper, you can just click on the equipment. And of course, since we're not integrated with MALDI, we did a mock with the main antimicrobial for the main bacterial found in the hospital. So let's say, for instance, that you isolate a Escherichia coli, and she is from urinary tract infections, okay? Then the system is automatically calculated based on more than 130,000 samples that this bacteria, E. coli, isolate from urinary tract infection is susceptible to nitrofurantoin in 96.5% of the case out of 10,000 isolates. Second option is fosfomycin with 95%, almost the same one. So the doctor can choose which one he thinks fits better to its patients. Third, it's an oral access drug, cephalexin, and then trimethoprim sulfamethoxazole. You can perceive that all the first option are access oral drugs. And then the second group, it's access EV only drugs, like amikacin that has a very high percentage that you can think of treating your patients if he has pyelonephritis, but not if he has an uncomplicated urinary tract infection. Then you will end up with one of those two, nitrofurantoin or fosfomycin, if the infection is not complicated. And of course, you have other options for watch drugs like amoxicillin clavulanate S with 81% susceptible, cefuroxime intravenous with 77%, ciprofloxacin that you can give it orally, but it's watch, so and it's not that much susceptible anymore. And then you have the watch IV only, starting with meropenem with a very high rate of susceptibility. But once again, your patient doesn't have a complicated urinary tract infection, you don't need to use such a high-level drug. And then, at last but not least, you have the Astrionan with an 80% susceptibility rate for watch drugs. So this report can be sent to the hospital or can be sent to the patient electronic health records, or can be sent even to the doctor's WhatsApp number. So there's plenty alternatives to do this. Of course, you can choose if the care setting is a hospital or outpatient also. If it's an outpatient, usually the bacteria are even more susceptible, and if it's a hospital patients, usually the bacteria is less susceptible because there are more resistant antimicrobial within the hospitals. So these are the features for the predictive AST, which it's been called PreDX. So that's about it. We'll be willing to help you with any additional information you might need it. Thank you for watching.